Alrighty, so this is my video for my, I believe, third objective involving manual therapy. So I was going to originally create a video where I would be demonstrating techniques and talking about um, how the PTs perform them on patients, but those that information is given to them during grad school, and I just don't have that extra education to be able to help me with through those techniques and hands-on maneuvers. So instead, I will be talking about the different types of manual therapy. You're in my corner, that's why I'm looking over here. But the different types of manual therapy that there are and when they can be useful and not, and also going over the instruments that could be used as well. I unfortunately don't have any on hand, but I do have a picture. So I'll be showing that hopefully with minimal technological difficulties since I'm recording on my computer. So yeah, so first I'm going to talk about soft tissue mobilization. Which is also instrument assisted if the PT chooses to grab one. So it's a skilled myofascial intervention, targeting the myofascia and the muscles. So just a quick show you. So the instruments, there we go. The three on the bottom right here. Excuse me. Oh, the three on the bottom. Hello. Are we focusing? I'm so sorry. Technical difficulties. I can only do it in one take. These three on the bottom are what are most commonly used for the soft tissue mobilization. So as you can see, the two on the left are stainless steel. Those are the most common. Oh my goodness, I'm so sorry. The most common tools to be used because they're based on the shape and such, they're a bit more contoured and can fit through different anatomical locations and sometimes help get deeper penetration within the muscles and myofascia. So there's a bit more of a zoomed in look so you can kind of see how one contours like this, and so that would be good for example the shoulders, and then this one could be good with getting in between the two calf muscles, the soleus and gastrocnemius. This one is not stainless steel, but instead a hard plastic. And this could also be good for shoulders, back, etc. Maybe so if they're a bit more sensitive to the metal going on to trigger points in their back, for example. It might be a bit more um, less aggressive, should we say. So yeah, the appropriate pressure while using these tools is very important. You don't want to dig in too deep. That will cause the patient pain, and that is about the last thing you want. Um, Not only do they break down the muscle trigger points if they choose not to be dry needle, but they also um, are able to break down scar tissue with soft tissue. So that can pretty much just mean that you're trying to move the scar in any little way you can and break up that scar tissue and mobilize that scar tissue. So it's not as tight and causing issues if it were before. Cupping, skin rolling are common techniques to do that with the scar. I can't demonstrate. I know what I've seen, but as far as the actual specific technique, I can't comment on that. Just what I've seen and how different therapists use different techniques for certain um, needs that the patients have. So not only, so that also, the soft tissue includes the scar mobilization. That's the specific term that I've come to find. Um, there is also trigger point manual therapy, which is just targeting those trigger points and knots within the muscles. There are also tools that can be used with this. They are more, again, a harder plastic. Um, they all have different shapes and sizes and different shaped ends to help reach different points in the muscle. So Yes, as you can see, there's a bunch of different shapes and sizes. Um, some are specifically made to be held a certain way or be used on a certain body part, but they are very helpful for targeting those specific points in a muscle where they know a breakdown is needed of that tautness. Um, Lastly, I'm going to talk about joint mobilization. So that is very important when it comes to post-surgical patients specifically, um, because of the stiffness that comes along after a surgery and the muscles not being used. So to make sure the joint is moving in the way it's supposed to and healing the way it's supposed to, you have to make sure that they have to activate those muscles around the joint. And in order to do that, um, they're massaging, they're making sure that those muscles around the joint are loose before they even start the appointment. That's another thing that I was wanting to mention as well. Um, Manual therapy is pretty much the same, or not the same, excuse me. One of the first thing that I've seen many of the therapists do there, just because it's a way to also help loosen the muscles and get rid of some of that tightness as well. And when it comes to the joints, it really enhances the joint mobility. If those muscles around the knee, for example, the hamstrings, the quads, the calf muscle, um, even some in the hip as well, if they're tight, that will affect how the joint is able to move post-surgically. You really have to make sure that those muscles are loose before you start exercising. Otherwise, um, there can be issues caused from that and further injury, and that's the last thing we want. So, really being hands-on with the massage um, is a great way to start out an appointment, but also make sure that there's the mobility, pain release, um, and um, what's the word I'm looking for? Flexibility, my bad. Flexibility within the muscles that they're needing to start the appointment and make sure that everything's healing correctly. Thank you.